So when patients come in and their concerns are mainly facial laxity, particularly jowling and extra neck skin is really the main two areas and stuff that we look at. So it's really interesting when you look at my practice like 25 years ago, our average age was probably 55, 60 years old. We'd be taking, 2 inches of skin off each side of the neck. I mean, it's super dramatic. And now, as time goes on, it's younger and younger patients, that are coming, and less and less surgery. So, there's a lot of terminology out there about like a mini facelift or modified or whatever. I don't look at any surgery as mini. I think it's, it's a surgery, and it really just depends. Trying to get the time involved to the surgical schedulers, like how much time we're going to need to do that. So it can be just a little, minimal jowling, minimal skin, and it takes, about an hour per side, or it can be, a lot of skin, just more advanced. So it's variable, but it's still just a facelift or neck lift. So, and then, I think that different concerns different patients have. If they come in and it's very early jowling, then like with Terri, we can do some non-surgical things. Some of the new technology we have, again, soft wave, we talked about. So looking back at your notes, I know you've had Profound, which is a microneedling radio frequency combination. So again, more of a surface-focused technology. We have a new Matrix RF, which is also microneedling and RF, or heat applied to the needles, and just advancement in technology where the needles are smaller, you have less swelling and those sorts of things. So, but the results are really super consistent. So I think most people have had or know about microneedling and things. So again, those are more surface-related things. But when you come to the point where everybody eventually does, usually, whether or not they do anything about it is different, but, just kind of coming consistently back, just getting to the point where, okay, I think I have enough skin that I really need to do something surgically about it. Then we have those techniques now available surgically, and just the advancement of the 2S and the different things we spoke about that just make the procedure, the follow-up, reducing complications, and everything just speeds everything up. Just the technology is just really light years where it used to be, and it's just super exciting now to bring patients through that. So.
And it is interesting because, as someone who spent her professional life in front of a television camera, I was always really self-conscious about my appearance. And now for almost everybody, you spend a portion of your life in front of a screen. Maybe it's Zoom for work, maybe it's social media, all those sorts of things. And so you really look at almost everybody as a mini celebrity in their own universe. Yeah. And so for someone in their maybe late 20s, 30s, early 40s, looking at the laser options just to make sure that they're as tight and fresh as possible. And then as time goes on, that Profound treatment, I think, was a real game changer. Yeah. I think for me, that combination of the heat and the microneedling probably pushed my facelift back by about 3 to 5 years. Yeah. Yeah. And so I would just encourage anyone who is in any way thinking they need to look more youthful, fresher, tighter, less tired maybe, that any of these treatments really could be a game changer for your overall personal presentation. Yeah, and we just individually evaluate patients, and they come to us with their concerns, and we come to them with different options and stuff like that, and present all those to patients. So we have certainly a lot of new technologies and techniques that we can do, and then when you get to the surgical point, then you can really have the confidence that, like, hey, the techniques now are so much better, recovery's faster, complications are less. It's just a
real different scenario than it used to be. So,
and we're living longer too. I mean,
Yeah,
1 in
sure.
5 of us are projected to live to be 100 years old,
Oh, wow.
right? So, and the median age for a woman is between 85 and 90.
Yeah.
So you look at an investment that you make maybe in your 50s and 60s,
Yeah.
who knows, maybe I'll be back for a refresher when I turn
yeah,
80.
you never know. I'm not sure I'll be here for that. But,
You'll be leaving me in good
somebody
hands
will.
at least.
Yeah, absolutely.